I'm Catherine Sachs, your social worker with a microphone, and you're listening to the Social Workers Radio Talk Show with Alyssa Lotmore, my co-host, MSW-LMSW. And joining us this morning is Linda Mertz. Linda is the head of the Navigators Program, which is the program that's associated with the Affordable Health Care Act. Linda is the coordinator of University at Albany's Internships in Aging Project, one of several model programs in the nation for training social workers to work with older adults. Lots of experience. Linda, great to have you on the show today. Welcome to the Social Workers Radio Talk Show.
Well, thank you very much for having us. Actually, I have you guys on speakerphone. Is this an adequate?
Actually, it sounds fine. I was discussing that with Alyssa before. Sometimes speakerphone has this terrible echo, but yours doesn't. To me, it sounds pretty good. Brendan, does it sound good to you?
Yeah, quality's good.
Yeah, quality's good, so we can stay with it.
Great, because I have two student navigators with me, and it would be great if we can all hear and talk. That would be helpful.
Great. First, you can answer it, or the students, whomever, but I went to that program on Friday, the New York State Department of Health, School of Social Welfare, and Rockefeller College. It was a 4-hour program discussing the Affordable Health Care Act and Navigators Program. Most people still don't get it. Even MSWs and well-educated people and academics. Tell us, what is the Affordable Health Care Act, and then how did the Navigator Program fit into that?
Okay, we're having a quick who's going to take that ball?
How about that?
Discussing what the Affordable Care Act is could probably take the whole hour.
Okay. I don't want you, but just sort of, anybody who's listening to say, okay, the Navigators Program, what is that? Well, maybe just what is it and how does it fit into the Affordable Health Care Act? What does it do?
Sure. Well, first of all, I think everybody hears about the Affordable Care Act and hears about Obamacare. It is one and the same. But the Navigator Program fits into the Affordable Care Act in that now there are all these people who are eligible for health insurance and need help enrolling and choosing a plan. So that is where we come in. We are the only school of social work who has this grant, but our navigators go out into the community and try to find people who don't have health insurance and help them figure out how to navigate the very complicated computer enrollment process.
So these students are MSW students here at our School of Social Welfare.
That's right.
Okay, and they've been trained, I assume.
Yes, they went to a very long and very detailed training session that is put on through the state, through the Department of Health.
What groups are you targeting? Who are they going to go see? What are who are the groups that they're going to see, number one? And then what kind of information, or how do they impart the information to them? What do they actually do?
Okay. Well, actually, there are a lot of people out there who can help people access health insurance information through the Affordable Care Act. But one of the things that we chose to do, I think, a little differently, why we wanted to use social work students, was we really wanted to target populations who may not be aware that they're eligible for insurance. They may be the folks who may be eligible for Medicaid or commercial insurance. So we are sending our student navigators into all kinds of different social service agencies, with a fair number of our sites being in very low-income areas. That's why we wanted to use social work students. We felt like they would have some of the empathy skills and be able to engage a real variety of people in the process.
All right, so they would be able to. They have the communication skills to be able to do that.
Exactly.
And Linda, all right, Linda, let's really be specific. I think one of the at the meeting or the conference last Friday, I think they mentioned Centro Civico. Is that one of the areas where we're going into?
Actually, we haven't used Centro Civico. That's interesting. It may be something that at this point, we're still open for sites. I mean, some of the things we've been going to Planned Parenthood, to Koinonia, which is a local health service organization. I'm not going to remember a lot of the food pantry sites, some of our local hospitals. What else have I forgotten? Some substance abuse programs.
So what do you do, actually? You go there, you set up an appointment? I mean, how does it actually work?
Actually, I'm going to maybe
give one to the students. Yeah.
Exactly.
Yeah.
And let me introduce them. Kevin O'Keefe and Ria Kumar are here with me, and They are both first-year MSW students, although we have both first and second-year students who are working in our program.
Okay, Kevin and Rhea.
Hi.
Hi. All right, it's time for you guys to talk and tell us exactly what.
A little nervous.
No, don't be nervous. It's fun. Well, it's just what you do. We just want to know exactly what you do, so that the average person who's listening to this will be able to understand it. We don't want to get too academic. Just what do you do?
So basically, we get either emails or calls into the office, and we answer them, and we ask people, where do they want to go to make the appointment, and we work in Troy, Upper Hudson, Albany, Schenectady. They tell us, and we make an appointment with them at whichever office they want to work at. And then the navigators basically go over there, and we talk to them, and we get all their information. And since some of the people are from a lower socioeconomic class, they don't even have basic things such as an email address or a phone number, so we kind of help them through that process and make an email address. And then we put them into the system and add all their information in, get all their tax information, ask all their income information, and then we're able to see what plans they're eligible for or what subsidies they would be able to get using the ACA.
Now, what do you feel that their reception is? Do you feel that they're overwhelmed by this whole process? Do you feel that how are they handling this, that they need health insurance now and going through this whole process?
Sorry, I think Kevin wants to take this one.
For the most part, I think people are just confused, honestly. I think this whole, thing in the government has really confused people. People don't know that it's the same thing as Obamacare. And when we meet with them, we have people who are totally lost, but they are thankful for our help. We have people who don't want to talk to us. They are, but for the most part, they're thankful for how we approach them and how we say, this is what's happening. Like, we can explain it to you in a way you understand, and we're learning too. So I think that's a good, approach to it, saying, if we don't know the answer, we will get it to you, and we're here to help you. A lot of people might see us as, as part of the government, and we're not necessarily part of the government who's trying to mandate them to get health insurance. We just want to help them navigate through the law that is being enacted.
Now, Kevin, you just said that even you could get a little confused because you're still learning of this process. Is the overall way to sign up in this whole process, is it confusing? I mean, as someone who's trained, it's still a little overwhelming. For the average person, what are some tips, I guess, or advice to help them through this process?
I don't think the process itself is confusing. I think there are so many people who have special cases that, we have numerous people who are calling us and saying they're going to be Medicare eligible in March. Do we have to sign up for now? Or, we have those types of special condition questions that, we in the general training did not, learn about, but we work with our partners and we get the information out there, and we always answer their questions, even if we have to refer them to another line. I don't think the process itself is confusing. I just think, the special cases that a lot of people are experiencing are what can confuse us navigators, because we, each new person has a new experience. So,
Rhea or Kevin, what do you do, like on the spot, on site? And let's say you don't have an answer. Are you sitting there with your computer or your iPad and then you find the answer or give them the answer right away? Or do you have to, is the follow-up that, you said you give, some of these people don't have email addresses, but then you set them up with it. Do you continue to have an ongoing relationship with them, or how does that work?
Well, we actually have a helpline for the navigators as well. So it's very useful because we'll be with them and we'll have a conference call with the helpline person on the phone as well. And usually, so far, every time I've worked with, I've had a question, I ask them, they are able to help me. So I haven't run into a situation where we don't know the answer yet on the spot. And obviously, if they email me and I don't know the answer, I call my coworkers, I call Linda. Linda has saved us a ton of time, get the answer, and then we just get back to them. And we'll remake an appointment for them, or we'll just email them and let them know what they need to do.
So would you say that our program the program here at the School of Social Welfare is one that's kind of like an example for the rest of the country? I mean, it sounds like it is. You said that we're unique in doing this with social work students. Is this something that would be sort of a guideline for other states?
So hard to say. I think we are reaching slightly different people different clients than other Navigator programs are. We've found a lot of people who will come in and then end up being eligible for Medicaid, which I think is not a typical response. Many of our partners, because as I said, there are lots of Navigator programs out there, are having not that many people. So I think we are reaching a certain niche population, and it's a population who certainly would benefit from health insurance.
Yeah, so I guess it depends on the demographics. Is that what you're saying, Linda, of the different states? And that's different. And New York State obviously is unique. As I understood from the, and I'm referring back to the program last Friday, we're doing pretty well in engaging people and getting people involved in the program. I think, aren't we I don't call it the best state, but we're the ones who are.
That's true.
Yeah.
New York has done pretty well in comparison to some others.
Our website is accessible and, shall I use the word easy to navigate as opposed to the federal government website? Is that true?
It's quite simple to navigate. I think people who know how to use a computer generally won't have any problems with it. But obviously there is like the older generation who are not very good with technology. But I think for the most part...
Watch it, Rhea.
But I think for the most part, people who are quite frequent users of the Internet are able to use the website as long as they have up and running Internet.
Yeah, but then you mentioned earlier, both of you, that the populations that you're serving, a lot of them don't have access to the Internet or haven't been used to using it or don't even have an email address. So it would seem to me that would complicate things.
It does. It really does. And I think that's where our training so far as social workers really comes in, because we really understand, we can really empathize with this population and understand that they don't have access to computers and, their situations may be special. And I think we really approach it from we're here to help you in no matter what. We don't like to call ourselves case managers, but, if they don't know how to use a computer, I have had coworkers who sit there and take extra time out to make sure they understand the entire process. And, I can't speak for other programs, but I know that is something that we pride ourselves in, that we take extra time, we care, and we just want them to, get health insurance.
Well, I think that's the social work background coming out, and I think that's why I really like that the social workers are taking on this role, whereas it's not sort of a person who's a bureaucratic employee who just wants to, get the paperwork in, and, if the person doesn't understand or doesn't have an email address, oh well, move on to the next case. So I really like and appreciate that you guys are taking on that social work type role in a healthcare setting.
I know you haven't been doing it for that long, but are there any suggestions, or are there any things that you have sort of, maybe both of you, Kevin and Rhea, sort of seen as a pattern of perhaps some of the pitfalls or some of the problems that maybe you haven't thought about or haven't thought about addressing that have come up? This is relatively new, obviously. In terms of assessing what you're doing.
We had a Q&A on last Thursday, a week ago, and I really had to stress the point that we are students. There are people who are doing this for 40 hours a week who have their agencies set up. So what we're doing is unique and at the same time sometimes difficult, because we don't have 40 hours. I think we have combined 40 hours between the 8 of us, but, we have, you're not saying other agencies don't have responsibility, but, we have field, we have classes, we need to take care of ourselves. So it's really been challenging to, not have that constant hands-on, working at this 40 hours a week. Linda and Bruce have been, obviously, since they are the forefront, but as students, we have many different hats, and I think that can speak to social workers in general that say, when we get into the field, we're going to have many different hats too. So it's just difficult because we don't have a concrete schedule.
Yeah, and I think that they, because we're going into different agencies, it's taken us a little while for them to figure out why we're there. So, we're developing relationships with those agencies, and that, unfortunately, does take some time. I think once they sort of figure it out, and it may be the person who's on the reception desk that night when our navigator is also sitting there in the lobby, if that person understands the benefit to the people who are going to that agency, great, we have a wonderful partner. But sometimes it's taken a little while for things that the CEO might think is wonderful to trickle down to the people who will actually connect our social work navigators with the actual client.
Yeah, I think that's a really important point because it does take time to nurture those relationships. And as you say, you got to be there. And when you are there and you establish a relationship, like you're saying, with the person who's at the front desk or whomever, it does make a difference. And then then they embrace the whole program.
That's absolutely true. The other thing I just wanted to point out is there are lots of people who can help enroll people in insurance. Many of them are representing different insurance companies. So, if Fidelis is out there selling their product, they can also help enroll people in the Affordable Care Act program. But clearly they're going to have a bit of an agenda, which our navigators don't have. Their training is very explicitly around being neutral in the process and helping people sort of assess what product is going to meet their needs when they get to the point of choosing health insurance product. So that's just another point I wanted to bring out there because I think that's another thing that, social workers, it takes some skill in some ways to be neutral.
I agree, and as you're talking, I'm thinking, what about, is there anything in the cards for like the social workers to kind of do the train the trainer with that kind of an attitude, or that kind of expertise and skill to help other perhaps groups? I don't know if this is part of the Navigator program here in New York State, but to do these train the trainer to train other healthcare workers, aides, assistants, whatever it is, to be able to also do similar, to be able to work with these people.
Yeah, that would be a great idea, but this is a federal thing down to state. It's got a lot of rules.
Yeah. A lot of rules and a lot of regs. Why did you guys decide to do this? I mean, you're, as you say, you're students. You have a lot of other things on your plate. This is not your 40-hour-a-week job. So both of you answer that individually. What was your motivation for doing this?
Well, actually, when I was interviewing for the job, Linda asked me the exact same question. And I just think as social workers, it's really important to be able to work in a big company and to be able to work with other people and see how the business side of social work actually works. And I mean, what better way to do it than to work directly with the state, really? I mean, it can't get any more confusing. There can't be any more people working on a project. And it's really great because as social workers, the Affordable Care Act is really something that reaches out to people who do not have insurance and who are not as fortunate as some other people who do have insurance. So as well as you helping out a large population of people, you also learn the insides to how policies are formed and how companies actually take on big projects and the obstacles that happen. Because, I mean, honestly, obstacles happen whenever a big project is being ruled out. And also, we're part of history, really. This has never been played out before, and we're literally sitting and helping out implementing this whole new plan. And so when everything starts to smoothen completely, we're going to say, oh my gosh, like we contribute to this and we actually saved some people. So I think that's the main reason why I was compelled to do it.
Well, those are all great reasons. What about you, Kevin?
I actually reflect a lot of what Rhea said. We got the email, 2 weeks before we came to school. I was out with my mother, and I said, look, Mom, a job. And she said, take it.
As mothers do.
Okay. I said, okay. And, it is, Rhea, I was going to touch upon this, that we are at the very forefront of this new system of healthcare. And, when I first interviewed, I didn't really understand that. But now that I see all the news media and all the stuff, I say, like, this directly affects me. And this is how, implementation, and I'm sure, social welfare policy, we talk about funding, implementation, why it is, and I am at the implementation stage. I am right there saying to people, this is what's going on. I didn't make the rules, and but I'm going to help you here. I'm going to help you understand this the best I can, and I'm going to, so I just think I chose it because it was a job at first, and it's become so much more now that I'm really proud of how far we've come just in 3 months. And yeah, it's just a great opportunity.
Yeah, it's a whole new field in healthcare, as both of you have said, I guess. I mean, it is. It's cutting edge. It's like this has never been done before. And it's actually a specialty, right, Linda? I mean, or will become one, I would assume. Or I would.
Yeah, absolutely. I mean, healthcare and health insurance are such hot topics for social workers these days. And I really do think that all social workers really should have some knowledge about, the implications of, what having insurance, not having insurance, what insurance you have, what does that mean? It's really critical stuff for people to understand in their practice. So it is a really unique opportunity for the students. And I have to say that they have been incredibly flexible. And, oh, my God, we sent them like 400 emails each day, like changing,
Yeah.
Oh, we said X. You know what, that's wrong, or we have to do it again in a different way. So they have been very both flexible and have integrated a lot of different pieces of information in their skill set in a very short amount of time.
Yeah, their skill set is going to be so much different than just say somebody who hasn't, or even social work students who haven't been involved in a program like this. I mean, they've really, literally just jumped in, and if 400 emails a day, I'm picturing that. But, yeah. But,
okay, I'm exaggerating a little,
but yeah, I know.
Not by much. Not by much.
Nope.
Well, that's great. We have to say goodbye, but I just want Linda to tell us. I mean, is there anything that you want to add to this, or
Well, I have to plug our own phone number. Can we do that?
I think anything that's on campus you can plug. I mean, I think because we're a college radio station, we can't plug things outside of the campus,
Okay.
but we can inside the campus.
Well, perfect. 'Cause
Yeah.
we really do. I mean, I know most students are covered by either their parents' insurance, thanks to Obamacare,
Yeah.
or may be enrolled in the schools program, but they may also have family members or friends who don't have health insurance, and we would love to help them navigate the process. Our phone number is 442-3854, but it's probably easier actually to get us via email, which is all one word, navigator UAlbany@albany.edu.
All right.
Okay.
Yeah. Okay. I think we've got the information. And if anybody didn't have a pen or they can't write it down, they can always call into the radio station and they can get us here next week if they didn't catch that. But thank you guys so much for being on the show. Linda, Rhea, Kevin, it was great. Now I understand it better, I think. What about you, Alyssa?
I do.
Yeah.
Oh,
Very
yay.
helpful.
Thanks for
Yeah.
having us.
Thank you.
Thank you.
All righty. Bye-bye.
All right. Bye-bye.
Bye-bye.
We're sitting here with Zsa Couture, who, by the way, they were great. Anyway, now I think we do have a better understanding of the program, the Navigator program. I just want to say Zsa's computer has like purple. I wouldn't expect anything different from you. Purple, what do you call those things? Purple keys.
It's a keyboard case. It's silicone.
Oh, with your sexy voice. So, do we have anything, Brendan? Do you have anything to add? We have to thank. I'm going to thank you again because you saved the show.
Oh, it's not a problem.
No, you-
Think nothing of it.
No, you really did, because first of all those, not just for us, but the guests who are out there. I
Right.
mean, the kids who do the program, and Linda and Amanda and everything. So, thank you, Brendan.
Yeah, it's really not a problem.
Yeah.
I would offer it to do it more often, but I think that Lucas got a good handle on it.
Yeah.
I just wonder what's up. I feel like this is an anomaly, right?
Yeah.
He's usually here.
Yeah, he is.
So
I mean,
it's really no skin off my back. I
Yeah.
think planned anyway.
I think he does take the bus, and so that's not necessarily reliable. I don't know.
See, the lucky thing for you guys is, though,
What is it?
that on Tuesday, my journalism teacher, who, I have journalism at 1 o'clock, he moved the test back a whole week. So I was supposed to have a test today that I could have been reviewing my stuff for. That would have been a problem, but luckily I didn't have anything scheduled for now. So you guys caught a break there.
We did. Social
We did.
workers are
Funny
blessed.
how the world works.
And you learned a little bit about the Affordable Care Act, if
right,
you were even
exactly.
interested.
And Rocky Mountain oysters.
And Rocky Mountain oysters. What a combination,
Yeah.
right? All right. We'll say goodbye. And thanks again, Catherine Zox, Alyssa Lotmore, and you're listening to the Social Workers Radio Talk Show at the University of Albany, WCDB FM.